Good morning. This is our Saturday scheduled yoga therapy class, and the title of the class is Yoga Therapy, Ayurveda and Western Medicine, a Healthy Convergence. Today's topic is yoga therapy, a healing from within. Now, I know a lot of yoga therapy teachers, physicians, healthcare providers, long-term yoga practitioners, and the new practitioners are watching this program from all over the world. So I like to give you the concept behind it. Like, for example, a very prominent and experienced yoga therapy teacher asked me what should be a practice we do for diabetes. And so my answer was that you need to have the concept. What are the concepts? So for diabetes, pancreas is seated all the way to the back of our abdominal cavity, close to the vertebral column, vertebral body. So we like to massage the pancreas to have some increased secretion of insulin. So all the asana poses which causes the flexibility of spine is also very effective for diabetes. So the concepts. Yogic concept is diabetes means body cannot digest sugar. Increase the digestive fire called Jathar Agni. Blood sugar goes high up with a very small dose of prednisone called steroid. The hormone of stress is called cortisol. That is a steroid. So you need to control your stress, the sympathetic overdrive with the relaxation response and parasympathetic activation. Same way, what is the concept of healing from within? So a yogic concept is that if you practice a daily practice of yoga, and as you know, yoga is a philosophy. It's a sutras, 196 small aphorisms, of which 193 is to control your mind, control the chattering of your mind. The practice is called 8 limbs, Patanjali Ashtanga Yoga. For yoga teachers, you have to memorize it. Yam, Niyam, Asana, Pranayam, Pratyahar, Dharan, Dhyan, Samadhi. It's also a daily routine. It's also a lifestyle. Daily practice of yoga we have seen to have an outcome of treatment of a disease and maintenance of health. This is, when is become this, we get dis-ease. And yoga practice is called effortless ease. When you have effortless ease, you counteract dis-ease. Flexibility. Flexibility will come with you with a practice. In stages, impossible become possible. Flexibility is health. Rigidity is dis-ease. And we as a physician talk about the ultimate rigidity is called rigor mortis. That is our death. When you die, our body becomes rigid. You can buy a dis-ease care. You can go to a doctor, you can get a medication, you can get an investigation, but that primarily does a symptomatic treatment. My blood sugar is up, take a medication, my blood sugar will come down. So all the medications we are taking for diabetes, or medication for hypertension, or medication for heart disease, are this correcting the root cause, what caused this disease? When you maintain health, we call it art of transformation from a patient to a healthy person to a yogi or ideal person. And the health you have to earn. You have to earn, you cannot buy health. You can buy a disease care. So let's talk about the healing. Where is the healing? Healing has to be at the cellular level. We call cellular healing. Again, you come to the diabetes. The simplest way, because I got a call yesterday. Somebody called me and says, why don't you do a session on diabetes? You'll say, how many people will join? I said, how about, let me give you a little concept. So if you think about diabetes, is two types, type 1, type 2. Type 1 is a low insulin, type 2 is called insulin resistance. But even if you think that pancreatic cells, the beta cells, are not producing enough insulin, so it's a cellular dysfunction. You go say, prana, teja, ojas. Prana is a cellular communication. Teja is a cellular intelligence. Oja is a cellular immunity. That is our disease fighting capacity. So now look at a scenario. I'm giving you the concept so you will remember this, and you as a yoga therapy teacher, you can pick and choose the practices you already have in your tool. Asanas, pranayamas, mudras, bandhas, kriyas, Ayurvedic philosophies, you can all incorporate as a yoga therapy. A person who is dying, what is the sequence of death? We call it person expired. Expired means his last breath came out. It is so fascinating. I was visiting Detroit, and I was in the Henry Ford Museum. The Ford who makes the Ford car, in Henry Ford Museum. In Henry Ford Museum there is a test tube, and the test tube, it says the last breath of Henry Ford. They collected the last breath of Henry Ford. Amazing. So you expire, your last breath comes out, then your lung stops. When your lung stops, your heart stops. When your heart stops, your cellular functions, your brain function stops. When your brain function stops, your cellular function stops, and the person dies. So if you improve your lung function, you improve your heart function, improve your brain function, improve your cellular function, you do cellular healing. So how to improve your lung function? Lung is like a balloon. It has a 6-liter capacity, of which 1.5 liter it stays all the time in the lung as a residual volume. That 1.5 liter you need to keep the lung open, like a balloon needs to stay open. Then you have a 4.5 liter of capacity which you can exchange, which is called a vital capacity. Of the vital capacity, you have 3 liters of called inspiratory reserve volume or inspiratory capacity. That means you can breathe in extra 3 liters of air in. And expiratory reserve is your 1 liter. 1 extra liter you can remove. But normally in a breathing, which is called a tidal volume, we only breathe 500 milliliter. That means half a liter. And of the half a liter, if you have a little anatomy, the 150 cc, almost 1/3, is sitting in the upper part of your respiratory tract, in larynx, trachea, bronchus, which does not exchange. That is called a dead space. So in the dead space, I have only 350 cc to exchange, which the body gives your carbon dioxide comes out, and lung takes the oxygen in and oxygenates the blood. So you have almost 80 to 90% reserve in your lung. So slowly and slowly you can build up the improved function of your lung. So at the beginning, we do breathe out first. When you breathe out first, we empty the lung and make some space for the air to come in. Then you breathe in slowly, effortlessly, and breathe out longer than breathing in. Easily we can do a 2-second in, count of 2 in, 1 and 2 in, and count of 4 out. But with the practice slowly and slowly, we'll be able to increase it. For us, we can do almost 10-second in, 20-second out. We can breathe out long. Close my eyes, I can breathe in effortlessly. I did 10 seconds in, 20 seconds out. And how is it possible? It is possible because the muscles of respiration, there are 2 groups of muscle. One, a muscle of inspiration, the muscle which helps you take the air in, and a muscle of expiration. These muscles are called skeletal muscles. Skeletal muscle means the muscle which can be trained. Like I have a biceps here. I can do weight training. I can do 5 pounds. After about 2 weeks, 3 weeks, I develop called a neuroplasticity, habit forming. My muscle knows I can easily do 5 pounds. I can go 7 pounds for next 2 weeks. Then in 2 months I can do 10 pounds. Maybe in 4 months I can do 15 pounds. I can train my biceps muscle. Same way I can train my respiratory muscles to have an increase in your volume of air in and increase the volume of air out. All the muscles of respiration are attached to your upper arm. The shoulder here, pectoralis major, latissimus dorsi, all the muscles, if you know the anatomy, you will know they're all attached here. So, if you have a better hand strength, if you have a better hand balance, which helps your building your pulmonary function. So practice. Hand strength, I'll show it to you. Tulasana. Sit down, put your hand, and whole body will go high up, raising your body from the ground. Bakasana, crane pose. Mayurasana, pick up. Mayurasana, pick up. Mayurasana, female version of the peacock, which is also called a Baddha Mayurasana. You do Padmasana, then do Mayurasana, peacock pose. Another is called a Pongu Mayurasana. The peacock became lame. It lost one of his legs. So you do, one-handed Mayurasana, peacock pose. It will come to you. But what most important thing is, these muscles needs to relax. Unless these muscles are relaxed, you are not going to improve your pulmonary function. Because when you're tight, what happens? You're tight, a very rapid, shallow breathing. That's your sympathetic tightness. When you relax, you breathe out first. Deep breath in. Comfortably. I do it with my eyes closed. So, what is the concepts? You need to relax your muscles of respiration, which we'll show it, we'll do it right now. You'll improve the strength and balance of your hand. Then you need to quiet down your mind. Quieting down your mind, kalmanasthir, it comes from activation of parasympathetic tone by yogic practice of branches of vagus nerve. Remember, vagus nerve is a parasympathetic activation of which 80% is afferent. Afferent means it takes the information to the brain. It goes to the brain stem, and 20% is efferent. Efferent. Afferent means A. The way to remember for your practitioner, A is the admit. Information is admitting into the brain. Efferent is expelled, it's coming out. 20% is only efferent. So do like a auricular branch of the vagus nerve in the ear, massaging the ear will do it, Then you have like a valsalva. Valsalva, it stimulates your pharyngeal plexus, able to bear it down as if you're in a bowel movement. You constrict your pharyngeal sphincter, anal sphincter. Remember, from mouth to your anal canal, the whole gastrointestinal tract is supplied by the vagus nerve. So once you got the concept, let's go and start our practice. So healing from within. There is no immunity from outside. Always remember that. There is no immunity from outside. Immunity all comes from inside. People say, oh, I'm taking this, I'm taking that. It's fine, in medical profession, we have a beautiful term we use. It's called a placebo. Placebo means I shall please. In some of the cases, the placebo has 30, 40, 50% effect. So, let's start with the relaxation, upper and lower part. Well, relaxation, body is like fluid, body like that. One of my friends sent me a comment yesterday. I was so impressed with the flexibility of your body. So my answer was, you have all seen my answer. In stages, impossible become possible. This is a famous quote from Desikachar. This is Desikachar. He's one of the father of our modern yoga therapy. He started the Vini Yoga. He's a student of Krishnamacharya. Desikachar. Every time he says, in stages, impossible become possible. So if you're able to sit down in the ground, so sitting down is called a Sukhasana. If not, sit in the chair. And I always showed you how to sit in a chair. So when you sit in a chair, what you need to do, and many of the practitioners here are also sitting in a chair. So you will have the chair, and I'm going to show you in the side so you can see what I'm talking about. And this I emphasize all the time. You will sit in a chair, you will sit in the front, you will keep your spine straight. The yogic term is called Merudanda Achal, called Manasthi. Merudanda Achal means your spine is straight, and Manasthi is your mind quieting down. Always, if you will sit down, and so what is the concept of keeping the spine straight? So what happens? When my skeleton is up, my skeleton is always going to fall down in the front. My skeleton doesn't fall in the back. So if you want to sit down in the back of your chair, you can go to the back of your chair, but always keep your spine straight. Do not have to support. So coming back to the concept, my skeleton is falling in the front. So the muscles in the back, called paraspinal muscles, they are contracting and keeping me straight up. So these muscles are always in a state of your contraction or spasm, and are very tight. It feels like a two stones sitting here. But when you start keeping your body straight, spine straight, slowly and slowly you will see you are giving a relaxation of these paraspinal muscles, and you feel a profound level of relaxation. This is the way you will always sit down in front of your computer. You will do this, and I'll show it to you. What else you do? You do Paschim Namaskar, prayer pose to the back when you're in front of a computer. This is the way you're going to eat when you're eating in a chair and table. You'll hold your knife and fork and eat like this. This is the way you'll drive your car. So you put your steering wheel, be sure you have this strength, you have this length, the body is straight, and that's how you're going to drive your car. So this is your 24/7 practice, keeping your spine straight. So all the practices we are going to do now, if you're sitting in a chair, you'll be able to do sitting in a chair. So we'll start the relaxation practice, and you have to remember one thing, that an imbalance in our body, mind and spirit is a true cause for all of our dis-ease. So in yoga, health is defined as a balance of the body, mind and spirit. And remember one thing, the word yoga, the original word is your yog, called jog. It's an anglicized version that a lot of with a problem with our tongue, we cannot say yog, so it's a yoga. So true yoga practitioner always says yog. So, if you are sitting, this is called your Sukhasana, easy pose. You take your both the feet, put it underneath your knees, keep your spine straight, and use your hand as a mudra. Hand mudras, these are called health in your hand, and hand gestures, we call mudras, are connected for your body and mind, to keep your mind at ease. Manasthir. There are a lot of mudras. I'm going to show it to you a little bit one by one. Before that, another concept is you need to activate your both sides of your brain to bring your health within you. The lateralized brain, I'm right-handed, right-footed, The lateralized brain is a cause of our ill health. So even your day-to-day practice, if you're right-handed, right-footed, you will see, we'll be doing our balancing poses, we'll do more with our left side more if I'm right-handed, right side more if I'm left-handed. Or if I'm right-handed, I learn how to eat with my left hand. If I use a fork, I'm trying to use my fork with my left hand. Or I want to brush my teeth with my left hand. Very interesting phenomenon. I always tell you about this. It's a common thing I tell you because I want you to practice. Brush your teeth, your brush will never come. But when a brush comes and a brush in the right hand goes like this. It's a neuroplasticity. Brain knows, see, I'm sitting like this. I'm not sitting. The brain is allowing you to sit. So, if you can sit down comfortably for a while, you change your legs. If you can sit down in other way now. Very, very important yoga therapy concept. Bringing the balance back. Next, in any asana practice, you will be sure that there is no pain. If you have a pain sitting down here, you will back off. But you stay in the pose. You don't push it down. If you push it down, it will come back higher. Slowly and slowly it will come down. No pain. It has to be an effortless practice. And then effortless breathing. The breath has to be completely effortless. If I have any effort in breath, it is not a healing practice. When I'm huffing and puffing, I'm running, I'm doing in the treadmill, I want to push myself. It's okay. It's okay. What it does, it brings you strength, stamina. Even we know from a lot of research studies, a little hypoxia to your muscle, stretching a muscle. There are a lot of theories behind it. It helps increasing your strength and stamina. But for healing, your breath has to be effortless. Exhalation is parasympathetic, inhalation is sympathetic. Okay, I'm talking because I wanted to sit down in this posture with the steps of relaxation. So steps of relaxation, able to sit down, and if you can sit down with my breathing out longer than breathing in, slowly and slowly I enter into a state of relaxation. A lot of hand mudras we talk about, touching index finger and thumb. This is called your Gano Mudra or Dhano Mudra. It quiets down your mind. With index finger down, called Vayu Mudra. It controls your Vata. This controls your Pitta, controls your Vata. Very good for your controlling your pain, neuropsychiatric disorders. Middle finger and thumb, Shunya Mudra, improves your hearing. Ring finger and thumb, Prithvi Mudra, earth, grounding, good for your diabetes, truncal obesity. Little finger and thumb, Varun Mudra, it's water content, improves your bladder function, corrects your stress incontinence, improves your body fluid. Ring finger, little finger and thumb, Shakti Mudra, strength. Prana Mudra, it brings your prana, the life force within our body. Middle finger, ring finger and thumb, Apana Mudra. This is your Pachan Mudra, Digestion Mudra. These are all the mudras, connects your body and mind. It's called a neurophysical connector for the flow of prana to the organ of healing. Wonderful experience. Put the index finger down. This is your Hridaya Mudra, Apna Vayu Mudra. A lot of other mudras are Vayana Mudra, Dhyana Mudra. This is called a Ganesh Mudra, remove our obstacle. This is your Linga Mudra. Hakini Mudra, your Shankha Mudra, your Shinna Mudra, balancing. After a whole section of the hand mudras, we'll talk about again. So touch your index finger and thumb, then what keeps us really in your tightness is our five senses. What I see, I have to look at, turn my head, so my muscle contracts. What I hear, same thing. My vision, my hearing, smell, taste and touch, five senses. You control your five senses, you quiet down your mind. Why? Mind is defined in yoga as the content of your five senses. What you receive through five senses is your mind. When the minds get more processed, this is called your intellect, buddhi. And buddhi gets more processed, it becomes your wisdom. Gyan is the wisdom. And your eyes is exactly a direct extension of your brain. Behind the eye is a large nerve called optic nerve, which goes directly into your brain. Eyes muscles are supplied by your cranial nerves coming from your brain. Used to remember SO4, LR6, the muscle called superior oblique muscle, supplied by the fourth cranial nerve. One is called lateral rectus muscle, supplied by the sixth cranial nerve. One cranial nerve supplies one muscle in the eyes. So the movement of the eyes called pratak is a very powerful relaxing practice. So close your eyes. The moment you close your eyes, keep your spine straight, do your Dhyana Mudra or a Jnana Mudra, you're already in a state of profound relaxation. Bring your awareness to your lung. Now you bring the awareness with your breathing. So how you breathe, you will start breathing out first, then you'll breathing in effortlessly and breathe out longer than breathing in, if possible 1.5 to 2 times. When you do that, you will see you will have a saliva in your mouth. When you have a saliva in your mouth, that is telling you that you have an activation of your parasympathetic tone. When you are fearful, when you are scared, your mouth becomes dry. That is sympathetic. Because your gland, the parotid gland, is supplied by parasympathetic nerve. So let's practice. The way you will practice, if you're doing it in a chair, you can do the same thing. Keep your spine straight and do the breathing in the chair. We'll breathe out first, then we'll breathe in. We'll start with a count of 2 in, count of 4 out. We'll go count of 3 in, count of 6 out. We keep on increasing. Count of 5 in, count of 10 out, count of 8 in, count of 16 out. And you don't force yourself. You find it out your level where you are still able to talk, you are able to sing. That is your effortless breathing. You continue over there. Okay? Let's start. I'll be progressing with my eyes closed and you follow as much as you can on your own. Breathe out first. I will do count of 2 in, count of 4 out. Very easy for me. Let me go to count of 4 in, count of 8 out. Let me go to count of 6 in, count of 12 out. Still very comfortable, huh? Let me go to count of 8 in, count of 16 out. Wonderful practice of relaxation. Again, I have to drink any water. I've been talking to you for some time. My mouth is wet. I have a saliva in my mouth. Activation of parasympathetic tongue. Next one is shutting down all of your 5 senses. It's called a pratyahara. Pratyahara, the 5th sense. Pratya means reject, ahara means intake. All intakes are through 5 senses. Then you create another vibration. Our brain is in a state of vibration. 2 vibration cancels. It's called harmonic resonance and completely quiets down your mind. It's called a bumblebee breathing, called Bhastrika Pranayama. That will be followed with your pumping and cupping. We rub the hands with the heat and then we'll massage your upper part of the body. So it can be done with the Shanmukhi Mudra also, using your hands, or you can put your index finger in your third eye. Use your 3 fingers to close your eyes. Use your thumb to close your ear and you close your mouth. You literally has shut down your vision, your hearing, your smell, and the taste. I'll breathe out first. I'll breathe in through my nose and breathe out through the nose with the sound of a bumblebee. I'll do it 2 times. Let's see if you can practice with me. Breathe out first. Take a deep breath in. Take both of your hands, keep rubbing your hands, and when you feel the warmth in your hand, if you're wearing glasses, remove your glasses, use the hand as a cup, put it over your eyes, let the eyes take all the heat from your hand, and massage your forehead, massage your ear, very important, massage your tragus, the one in front, back of your auricle. In fact, extranear canal, because there is a branch of auricular branch of the vagus nerve. It's very relaxing. Massage your eyes, massage your face, and in the neck there is called carotid sinus. You massage your carotid sinus. Carotid sinus massage is very relaxing. In fact, we do it, the cardiologists do it, when there was supraventricular tachycardia, when the heart rate went high up, you do the massaging of the carotid sinus. Very relaxing. It also happens, Jalandhar Bandha, the chin lock. Massage your back. You're in a profound state of relaxation. So I'm showing it to you slowly and slowly because these may look like a very simple practice, but it has a profound physiological effect. And to demonstrate it, you see, next, what I said, in stages, impossible become possible. I take my heel all the way to the back, take my other foot, and my knees drops down in the ground. This is called a Siddhasana. Perfect pose, easy pose to perfect pose. Now if it doesn't go down, if it is here, let it be here. Why? If you push it down, what will happen? It will come back up again. Close your eyes, do the relaxation. A progressive muscle relaxation is going to do it. These are called stages of the asana. Arambho is the beginning. Muscle contracts. Staying for a longer time, muscle cannot stay contracted for too long. Muscle will start to relax. Before it relaxes, it causes a fasciculation, like a twitching. When the twitching stops, it is called sthiti, very stillness. Then it's called your visarjan, relaxation, profound relaxation. 3 stages of asanas. So next I can slowly take my other foot in the top and let other knee come down. This is your half lotus, Ardha Padmasana or Swastika Asana. The whole foot get relaxed when you will be able to separate your toes. So I do, in sitting down like this, I take my hand, I separate my toes. So I'm separating my toes, my feet get relaxed. People ask me, I have a pain, I have in my heel, pain in my foot, what to separate your toes. The moment, see initially I don't able to even put it in. Oh, it was so tight. But now you can see it easily goes in and out. The sign of relaxation. Tightness causes pain. Or you can do a practice like this, we'll do it laying down, but you can bring your knees way high up. Slowly drop the knees down, you'll come down all the way to the ground. It's relaxation of the hips, relaxation of the knees. It's a powerful tool. Again, balance it, go to the opposite side. The other foot in the top. And again, my left hand goes here. Even sometimes I do it with my right hand. Right hand goes into this foot. Even I will rotate my ankle. Powerful relaxation practice. So remember, separation of the toes. The market is full of yoga toes, yoga socks, yoga shoes. All the concept is separate these toes. Hand. Hand will get relaxed when you use the hand like a baby. Why? The babies do everything in yoga. Because babies are in a progressive muscle relaxation. If you look at a baby when the baby is sleeping, baby's exhalation will be longer than inhalation. When the baby sleeps, you'll see baby will have a abdominal breathing. When you breathe in, abdominal wall will raise high up. When you breathe out, abdominal wall will go back in. A powerful tool. Relaxation response. So hand, if you know the babies, how the babies closes their hand, the babies will do, if you do it like this, they'll take the thumb inside and close. This is called Adhi Mudra. Even if you can look my hand, if you touch your index finger and thumb and put the hand high up, this is your Gyano Mudra or Dhyana Mudra. If you put the hand down like this, it will be your Chin Mudra. Chin Mudra, it opens your lower part of the lung. It is part of your Pranabha Pranayama. A, U, Ma. A comes from the lower part of the lung. U comes from the middle part of the lung. Ma comes from the upper part of the lung. When you close the fingers like this, it's called a Chinmaya Mudra. It opens your middle part of the lung. If you're with me, keep doing it. It's a beautiful practice. Then you can put a thumb inside and close. This is called Adhi Mudra. By the time you do this, all the pain in your hand will go away. Arthritic pain. So you can do it with breathing. You can put your hands in front. You're sitting in a chair. Just put your hands up in the front. Close your eyes. You breathe out first. Take a deep breath in and close your hand like a baby fist, called Balo Mushti Mudra. It's like a baby fist, the way a baby closes the fist. Okay, try one more time. Breathe out first, take a deep breath in and breathe out. Wrist gets relaxed with extension. If you do the extension of your hand, wrist gets relaxed. So correct? You breathe in, breathe out. Breathe in, breathe out. I always practice with my eyes closed, and I'm showing you the technique. So when you practice at home, you do it a little longer. How long? As long as you don't have any pain, and as long as you have an effortless breath. So, if you're able to do that, when your wrist gets relaxed, what you'll be able to do, you can put your hand here. If the hand will be initially like this, and slowly hands will go all the way down and in the ground. By the time the hands gets relaxed like this, all the tightness of the hand will go away. You'll feel a profound level of relaxation. Now, what I was going to show it to you, now I can put my other foot high up. I can get into a lotus pose or Padmasana. See, I could get into the Padmasana right away when I'm sitting down. But I did not do it because I wanted to show you the progressive muscle relaxation and voluntary control of your breathing, which is pranayama, is the therapy for healing from within. So normally my breathing, even if I don't try, I'm going to breathe. I'm sleeping, I'm breathing. That is a function of my lower brain. That is called a brain stem. But involuntarily I can take a deep breath in. This is the function of my upper cortex of my brain. My motor system is working to have the muscles. So it's connecting between your brain stem and the brain cortex. Brain stem was subconscious, cortex is conscious. It's connecting to your subconscious to the conscious mind. Shoulder gets relaxed with rotation because it's a ball and socket joint. So put your hand in the shoulder, slowly bring your elbows together. Remember, wherever it comes, if it comes here, it's okay. If it comes together with your breathing. Breathe out first. And also I with my eyes closed. If with eyes closed, you get a lot better relaxation. Breathe in first. Slowly rotate your shoulder with your breathing. Breathe in here in the middle. and breathe out. Breathe in, breathe out. Now again, always balance it to the opposite down. Breathe in, do the opposite way. I'm rotating. A frozen shoulder, rotator cuff tear, this all will get better. A chronic pain in your shoulder, because the pain is due to tightness of the ligaments. Remember all the things, our orthopedic surgeons, all the physician talks about, oh, your cartilage is gone, your cartilage is damaged, your shoulder cartilage, hip joint cartilage, knee joint cartilage is gone. So remember, cartilage doesn't have a pain fiber. When I'm developing a degenerative joint disease, or I'm developing some inflammatory joint disease, arthritis, body tries to do splinting. Try to do splinting, and try to do splinting, it tightens your ligaments, tightens your muscles, and all the pain fibers are there. Pain fibers are there in your muscles and ligaments, and that is causing pain. So if you learn how to relax your shoulder joint, how to do this, shoulder joint, and pain in the shoulder goes away. Another one is very important for your removing your pain and bring the healing is a Bhastrika Pranayama. Bhastrika, a normal breathing is your active inhalation, passive exhalation. Bhastrika is a bellows, and the bellows you do active inhalation, active exhalation. Bellows you use for your, like a fireplace, bellows you use for like your blacksmith uses. So if you use active inhalation and active exhalation, you're like a pain. So remember the shoulder pain, neck pain, the upper part pain is tremendously disabling condition. So when you do the Bhastrika Pranayama with your hand movements, you relieve your pain. So Bhastrika Pranayama is like active inhalation, active exhalation. So people always ask me, when do you breathe in, when do you breathe out? So a muscle needs the oxygen. So think about this. When the muscle is contracting, it will need the oxygen. So here is biceps. Before it contracts, I'm going to breathe in. So I breathe out first, I'm breathing in. When breathe out, I'm contracting. Why? Because the oxygen will come in. Here, I breathe in, breathe out. Same way of the triceps. Here, I'm breathing in, breathing out. My triceps are working. But in a therapeutic pranayama, what you do, you are going to do balancing. So if you're doing a Bhastrika Pranayama, so just like a simple, I'm doing inhalation and exhalation. If you want to do with me, so you got it. As inhaling, exhaling, inhaling, exhaling. But in a balancing therapeutic pranayama, you are going to do opposite. You always try to do a balancing breathing in therapeutic pranayama. You see when you get sun salutation, Surya Namaskar, you start with the exhalation, you end up with inhalation. Start with inhalation, end with exhalation. Lot of ways you do, like if you're with the shoulder and the shoulder shrugging, very nice, these are actually very relaxing asanas. But And keep on continuing. I do 100, 200 very easily. You can do the very rapid Bhastrika Pranayama. These are the signs of health and the healing. Your Adi Mudra, you're doing a rapid Bhastrika Pranayama like this. Easily I've done 100. I'm talking, I'm breathing, totally effortless. Day-to-day practice, I do 400, 500, 600, strength. That keeps you, this is free, medication free, quality, healthy life, healing from within. Good lung, good heart, good brain, good cellular function. What else you need? You can do with the hand raise lot of ways, you know. I mean, you do Bhastrika Pranayama like when you'll be doing, so it's like last week, if you go and see, I did a push-ups and sit-ups. When I was doing a sit-ups, I was doing a, put my hand on Palwani Baitak. Sitting down and standing up, sitting down. Can do the hands raising high up. People ask me, why do you do? You know, it relaxes. Now sometimes people have a frozen shoulder. I tell them to do it eyes closed. They will do it like the legs have frozen right shoulder. They'll do like this. When the eyes are closed, slowly. Ask them, do you know you've been moving your right shoulder? Yes. My mind was in my breathing. I had no idea. So doing the 3 sequence is called your Ishwar. And when you pull it down with your Adi Mudra, Bala Mushti Mudra, baby fist. Normally we do about 20 counts, very slow. 20 medium is called So Hum. So hum, and faster was called Vishnu, Vishnu. So we do it a cycle after cycle after cycle. We do 2 cycles, 6 cycles, 8 cycles. Let's do 1 cycle. Do 1 cycle, and if you cannot continue with me, you do it where you are, or you can stop and do it. Just simply breathing out longer than breathing in. Okay. We'll do 20 slow, 20 medium, 20 fast, Bhastrika Pranayama. Slow. Sequence will be Ishwar. With a little smile in your face. Do not have this all tightness in your face. Medium pace, 20 of them. So hum, 20 medium. Let's try. Fast 20. Vishnu, Vishnu. sequence. I'm fine, I'm talking, I'm breathing, except let me get a little see, I do every morning with a gel neti part. So you do have some drainage will come out through your nostril with the Basilica Pranayama. It is entirely normal. And in our regular class, we keep a Kleenex, a box of Kleenex for us, and in fact, after this, you will see, wow, amount of air you can breathe in and amount of air you can breathe out. It's a wonderful practice. Pranayama also should be done very effortlessly. So this also relaxes your muscles of respiration. Wonderful practice. Always breathe through your nostril. Breathe through your nostril. Nose is like your personal air conditioner. It filters your air. If outside air is warm, it will cool it down. Outside air is cool, it will warm it up. It also glides through the side of the nostril, called a turbinate. Turbinate guides the air to the larynx and goes to the lung. All the air you breathe in through your nostril goes into the lung. And when it goes over the mucosa of the sinuses, it secretes a substance called nitric oxide. Nitric oxide is a potential, very powerful vasodilator. It also acts on the lining of your blood vessel called endothelium. It secretes your cyclic GMP, acetylcholine, which are your transmitter of parasympathetic tone. So nasal breathing also is parasympathetic. Exhalation obviously is parasympathetic because exhalation is a function of your lung, especially when you do breath holding. Breath holding in inhalation, called retention. Lung slowly expands. When it expands, it gets into a phenomenon called a herring-brewer reflex. In a herring-brewer reflex, the vagus nerve comes in. It starts initiation of your exhalation, and the breath holding abhantarin kumbhak is a profound relaxation response if it is done effortlessly. So the neck is a very tight muscle. You also relax your neck. Brahma Mudra, it has 4 distinct posture: back and the front, side, looking at the back, and rotate your neck. We have done it so many times, but I want to do it because I want you to do every single day. This is a daily practice, Brahma Mudra. Like to do with the Bhramari Pranayama, because the Bhramari Pranayama will bring the relaxation a lot more. So the technique will be, you breathe out first, take a deep breath in and slowly drop your neck to the back. And with the Bhramari Pranayama, you will slowly come in the front. When you're coming in the front, You have to look for your body's response. What is the body's response? First is a pain. When you're bringing it down, if it causes pain, you back off. Effortless breathing. If you're effortless breathing, you continue. Do not practice a yoga asana after taking pain medication. When the pain response is gone, your protective mechanism is gone. So let's do the whole practice of a Brahma Mudra with a Bhramari Pranayama. Breathe out first, breathe in, drop your neck to the back. Breathe out. Side to side movement. Breathe out first. Take a deep breath in. Breathe in. Looking at the back without turning your shoulder. Breathe out first. Take a deep breath in. Breathe out first. Take a deep breath in. Then slowly rotate your head, one on both sides, the same sound of a bumblebee. So breathe out first. Take a deep breath in. breathe out first. Take a deep breath in. By the time I do this, you're in a profound level of relaxation. And you must have noticed it, or if you have not noticed, I'm putting my finger in between my toes when I'm doing the whole practice. Whole body get relaxed with a powerful yogic asana. It is your squatting pose, malasana. If you can do the malasana, your whole lower part, upper part, whole body get relaxed. If you can able to sit down in a malasana, you can see me. I'm sitting here. Look at this is the way my ankle is relaxed, my knee is relaxed, my hip is relaxed, my back, all my lower part of the body is relaxed. In upper part, I separate my fingers. The fingers gets relaxed. Extend my wrist gets relaxed. Put my one elbow inside, other elbow inside. Slowly I bring my hand close to me. Keep my spine straight, my eyes closed. Look at that, my whole upper part of body, lower part of the body. This is the sign of health. This is the healing from within. By the time you do this, your ojas will be up, your immunity will be up, disease fighting capacity will be up, no disease will come and attack you. You need to get into this state of your flexibility of the physical body and your effortless voluntary control of breathing. 2 terms. Progressive muscle relaxation, voluntary control of your breathing. Good sign of health is able to get up without a support. If you get able to get up without a support, it is a sign of your health. So practice this. Practice able to get down and able to get up without a support. Bring your balance back. Most important thing is your balance. So you have to always bring the balance back. So standing balance is very, very important. We're comfortable standing like this. So if you see if you can stand with both the feet together. Going against the grain of your habit is yoga. Then to bring your balance back, remember balance comes from your hand, balance comes from your vision, also from the inner ear. You only have to lose balance, you always check on this. So try to take the function of your hand, because see when I fall down, what I do, I fall down on my hand. I fall down in my hand first. I get a fracture, called a Colles fracture. Very fascinating yogic practice. So when you take out your hands, let me show you, it is called your prayer pose to the back. Normally do the prayer pose to the back. This is called Dandayaman Paschim Namaskar. Dandayaman means you're standing. Paschim Namaskar means your hand to the back. So take a look at it now, me. I'm putting my hand to the back. Slowly and slowly I'm getting into a prayer pose, and I'm putting the prayer pose here, and you try wherever you are, and then you can breathe in and out. Here all the spine gets straight. You breathe in and out completely effortlessly. Slowly it will go high up a little bit. Within a few months it will happen. Sometimes in a lifetime this will happen. And you'll be able to stay in the posture. It's not getting in and out of a pose. Able to stay in the pose and able to stay in completely pain-free and effortless breathing. You will see, if I try a little bit more, which will cause a imbalance in my body, which is called Annamaya Kosha, it will show up in my breath. It's called Pranamaya Kosha. So I'm right-handed, right-footed. See if I can stand on my left foot. I'm standing on my left foot. 10 seconds feels like a lot longer time. 20 seconds is a good timing. 40 seconds is perfect. Finally, what initially almost impossible, but you can do with the practice, closing your eyes, and if you can stay balanced in one foot. Hands in the back in the prayer pose, eyes are closed, and you are balancing on one foot, especially your non-dominant foot. I practice every single day. Still, I'm not perfect yet. This has been tried in multiple clinical studies which showed that this is a sign of health. You do your exercises, you get a tread made, you run, you do the weight training, it's good. That is called sympathetic activation, sympathetic overdrive, which follows with your parasympathetic activation. So try in your opposite foot now, and you will see your one foot is easier than the other. Why? Because you're lateralized. One side of your brain is working more than the other. I'm right-handed, right-footed. I feel not comfortable with my right foot. So what I need to do, I need to do practice more on my left foot to bring the balance back. Close my eyes. It's almost become impossible initially, but it's a wonderful practice. So, what do you do when you get up? If you cannot get up on sitting down, if you put in one hand, you lose 20% of your health. Two hands, you put 20% of your, 50% of your health. Another very powerful sign of healing from within, which is really a basic sign of health, that if you can able to sit down and get up from sitting down without any support. So, if you are doing with me, see if you can do it with me. You're sitting down with my feet a little crossed. From here, oh my God, I cannot get up. No, easily you will be able to get up. If you can get up from sitting down, this is a wonderful practice. Same way when you want to balance it, cross your feet. Cross your feet if you can sit down, crossing your feet, and get up crossing your feet. Incorporate this in your daily practice. To the opposite side. I'm crossing in the opposite side. I'm sitting down. I'm getting ready. Getting into the Mayurasana, getting into a shoulder stand, headstand. Very nice you can do. But these are the signs of health. It's a healing from within. Able to get up, called sit-rise test, able to get up with the balancing. Next one is a very good sign of health, is your head below your heart. What does it do? When your head comes below your heart, your pressure inside your brain goes high up. It is called your intracranial pressure. What is interesting is that, remember I said, your lung improves your heart function, improves your brain function. And look at the physiology behind it. When you breathe in inhalation, the cerebrospinal fluid, the fluid around your brain, it collapses. And in exhalation, it expands. Brain, you reduces and expands along with your breathing. In fact, when you do hyperventilation, like your Bhastrika Pranayama causes hyperventilation, you also get a cerebral vasoconstriction. So, hyperventilation reduces your intracranial pressure. So when you're practicing, our neurosurgeons, like say they did a surgery or patient has a trauma in your head, and the pressure inside the brain is high. Remember, when the pressure goes high up, because its skull is very rigid, it's a very severe situation. They used to intubate the patient and hyperventilate. When they hyperventilate, the intracranial pressure comes down. So these are the concepts I'm giving it to you, especially if you're a healthcare provider. Next, if you keep your head down, see your pressure inside the eye also goes high up. Pressure inside the carotid artery goes high up. You cannot talk, you cannot breathe, you are all flushed, you feel miserable. But slowly and slowly, if you keep your head down, your homeostatic mechanism comes in. So, your limbic system, hypothalamus, pituitary, adrenal axis comes into the play. Intracranial pressure comes down, intraocular pressure comes down, intracarotid pressure comes down, and always remember that whatever imbalance you create in your physical body, even if it is a inside intracranial pressure in your eye, which is called a glaucoma, goes high up, your breathing gets interrupted. So people says, I have a little glaucoma, should I do it? I said, probably not. But if you want to get rid of the glaucoma, slowly put your head down. If your breathing is effortless, stay there. Don't have to do too far down. See, what I'm doing, I'm spreading my leg now. This is called your Prasarito Uttanasana. Wide angle, hand touching your feet. And then what I do, I slowly put my hand and drop my head down, wherever it comes down. When it comes down, I put my hand, I start to. Generally, you will be able to do almost the whole width of the mat. If you go a little bit farther, it is split, so Hanumanasana, and slowly able to put your head down. You are in a profound level of relaxation. You can also even do a pranayama. You can do a Kapalbhati Pranayama. You can do all the pranayama standing here. You're talking, you're breathing, you're totally effortless. It's a wonderful practice for improving your health. This is the healing from within you. Head down. This is called your Prasarito. Widespread Uttanasana or Padahastasana or Pada-Uttanasana and a Kapalbhati Pranayama. When you do Kapalbhati Pranayama, it also massages your pelvic floor. It's a wonderful practice for your pelvic floor function. For women with a better pelvic floor function, men with a benign prostatic hypertrophy, Another very powerful function of your health is able to incorporate your Bhastrika Pranayama with your practice. So if you do like a, say, called Sadharan Baitak, simple sit-ups. Hands in the front, you do a Bhastrika Pranayama. Like wonderful practice. You can do also, you can do a longer exhalation. Longer exhalation you do like this. You can do then 1 inhalation, 3 exhalation. You can also do with your push-ups, simple push-ups, Sadharandan. There's also called Baitak, Hanuman Baitak, Palwani Baitak, Sadharandan, Ramurti Dan. Let me show you one, at least one. You can see what do I mean. You can see me. Yes. With the breathing and a push-up. This is the way you keep your health. Normally you do a push-up, you go down, go higher. Ramurti then, you go down, you come back in the same way. Lot of hand strength, lot of hand balance. Misodhan, sit down like this, go back to back, do your push-ups, come back in the front. And you continue this. I'm just showing it to you, but when you practice it a little longer and longer. I can continue for a long time the sign of your health. This is yogic sign of health. Able to go down, come back in the same way. Ramurti Dharan. The Parshadan, put your feet on one side. I've shown you actually last time. If you go to my last Saturday's video, you'll see all of them. Parshadan, Misradan, a whole lot of them we have. We have a Sharpadan. You can do a push-ups with your cobra pose. Shiradan, you can do almost like your Shishasana, headstand with the dan. Chakradan, rotate your body and do a push-ups. These are our yogis used to do to keep their body healthy. Pranayama is a daily practice. Pranayama we do, as I said, daily practice. You do 25 minutes of asanas. You rotate your asanas, you do different asanas, different day, but do a relaxing asanas. And you feel very fluid, your body is so relaxed, Your respiratory muscles are relaxed. So, if you think about hand strength, we do all this time, but just let me show you one. We'll do slowly, one at a time. People always ask me, show me your peacock pose, Moirasana, Moiriasana, Pongu Moirasana, Bakasana. Bakasana, if you go to my Facebook page, you will see elephant doing a Bakasana. So how easy it is. Put your hands down, hands supported, just slowly push your body down, whole body goes high up and stays high. Bakasana. You are like like a crane. Why? It helps your voluntary control of your breathing, pranayama. So the first pranayama is your Bhastrika Pranayama, Bellows. We call it a gateway of pranayama. You have removed all the carbon dioxide and you bring the oxygen back. Next one is your Kapalbhati Pranayama. Kapal is the forehead, Bhati is the shining. It is called your Detoxifying Pranayama. Removed all the toxin. There is a balloon here, diaphragm here, balloon here. Bring your awareness in the belly button, push it back in, it hits the diaphragm, all the air comes out. So let me tell you a little bit about this Kapal Bhati. Kapal is the forehead, Bhati is the shining. It removes all of your toxin. It ignites your Agni, the fire, Jathar Agni, digestive fire. It creates a Tejas. Tejas is the fire within you and looks like you are glowing. There's an aura around your face. There's a lot of other ways to say it, it improves the blood supply to your frontal brain, but it's Tejas. When you do this yoga practice, your friends will take a look at you and say, wow, look at you, you are glowing. Glowing. What? You had a facelift done. Let me see the scar where you had a facelift done. It's a wonderful practice. Kapalbhati done very slowly, 1 per second, effortlessly, it is your pranayama. Kapalbhati done very rapidly. Very rapidly is your kriya. That is your cleansing process. Yoga has described 6 cleansing techniques. Tratak for your eyes, Nasya for your nose, Dhoti for your stomach, washing your stomach, Kapalbhati, Nauli is your finding the rectus muscle and moving it side to side, Basti cleaning your colon, cleansing of physical body, Sharir Shuddhi. This is also called a Shodhan Kriya, cleansing your body. Even your Bhastrika done very rapidly is also a cleansing technique. We do all jal neti. We use the neti part, put through one nostril, water comes out. Every morning we do as a daily practice. Kapalbhati also incorporates the jal neti. So when the Kapalbhati is done for your kriya, like cleansing very rapidly, the way to be, but effortless. The way to do a Kapalbhati for rapidly, I could continue. The difference between this and a Bhastrika was inhalation, exhalation. If you say Kapalbhati, rapid, all exhalation and inhalation in between, completely passively. When it is done through a very rapid Kapalbhati Pranayama, but you still effortless, you're talking and breathing, then you incorporate all the 3 bandhas. Abdominal lock, chin lock, and a root lock. This is called your Vata Karma. Vata Karma, it's called a Vata Kram. And when you include Jal Neti, you take the water through the nostril and bring it out through your mouth. Take the water, hold it in your mouth with a Kapalbhati. It's called Vayukram. Opposite is called a Sitakram. Take the water in your mouth, keep it in the mouth, and then with your Kapalbhati, water comes out through your nostril. From mouth comes out through your nostril. It's a very wonderful yogic practice, yogic technique. This is all due to relaxation response. So whole Kapalbhati relaxation. So all Kapalbhatis are done with the mudras. So basically, that's just to show you the technique, because you do it at home on your own. So spine straight, eyes closed, awareness in the belly button, push the belly button in the back and the air comes out. Just keep on doing, and let me tell you the benefit of this pranayama. If you're new to it, you can put your hand in the belly button, you'll see the air comes out through your nostril. Do it a different mudras, this one, Vayu Mudra, Shunya Mudra, Prithvi Mudra, Varun Mudra, Shakti Mudra, Apna Mudra, Apna Vayu Mudra, Linga Mudra, all the mudras. Let's do the 5 or 6 mudras. Let's do about 10, 20 counts, and I'll tell you the benefit of this, and you keep on practicing. It massages the internal organs. Massages your liver, massages your stomach, massages your spleen, massages your pancreas, change your mudra, Vayu Mudra. Massages your small intestine, massages your colon. For the female, it massages your uterus, tubes, ovaries, change it to Shunya Mudra. For the men, it massages your prostate gland, urinary bladder, all the intra-abdominal organs. Also, it massages your adrenal gland, the master gland. Prithvi Mudra, it also massages your diaphragm, the muscle in between your chest and the abdomen. From the diaphragm, it also massages your lung. So all the air comes out, but there is no inhalation. I'm only doing an active exhalation. Change it to Varun Mudra with the limb finger. So do the mudras with the Kapalbhati Pranayama, you get a synergistic effect. That means you get an effect of more than 2 by doing 2 things. So I'm not breathing in. I'm only breathing out. But I'm breathing in between without knowing. Why? The day I was born, I took a deep breath in. Nobody told me how to breathe in. You don't need to learn how to breathe in. You need to learn how to breathe out. All the carbon dioxide and toxic material comes out. Detoxifying Pranayama. Prana Mudra, Shakti Mudra, ring finger, little finger and thumb. In between the lung there is a heart. It also massaging the heart. In yoga says when you massage your organ, the organ function gets better. If a thyroid gland needs a treatment, you massage the thyroid gland. Ujjayi Pranayama massages the thyroid gland. Fish pose, Vatsasana massages the thyroid gland. Sarvanga Asana, Halasana, Ushtrasana. Same way, even when the heart stops, Apna Mudra, middle finger, ring finger and thumb. When the heart stops, we push the massage the heart from outside. It's called cardiopulmonary resuscitation, CPR. This is the internal CPR, massaging heart from inside. Wonderful practice. This is called a Hridaya Mudra or a heart mudra. Apna Vayu Mudra, index finger down, this improves your cardiopulmonary function. So you're going to improve your cardiopulmonary function, you do Kapalbhati Pranayama on this mudra. If you have diabetes, you do Kapalbhati Pranayama with your Prithvi Mudra. People ask me all that. If you have the concepts, you don't forget. That is more important. I do it about maybe 50 counts in each mudras. I will do about maybe 500 to 1,000 of Kapalbhati Pranayama daily. For you, you do only until effort. When your effort is there, initially we do 30 seconds, it's good enough. Effortlessly, if you bring it up, your target is between 5 to 10 minutes. Third pranayama, alternate nostril breathing, Anulom Vilom Pranayama. I'll just show you the technique and I'll show you a little bit of a breath holding with Anulom Vilom Pranayama. So left hand to the mudras, Dhanu Mudra, Jnana Mudra, right hand, the right nostril, close your right nostril just below your nose. Breathe out through your left nostril. Breathe in through your left nostril. Drop your hand down, close your left nostril with the ring finger and little finger and breathe out through your right nostril. Bring in through your right nostril. Close your right nostril, breathe out through your left nostril. Let's do a few alternate nostril breathing and let me tell you the benefit of this pranayama. Left nostril is controlled by the right brain. The right brain is intuitive. The right brain is cooling. Right brain is female. Left nostril breathing is called cooling. Chandra Nari, moon energy. Ida and Nari. Right nostril is controlled by the left brain. Left brain is heating. Left brain is analytical. Left brain is male. Right nostril is heating, sympathetic. It is called your Suranari, sun energy, Pingala. It balances both sides of the brain. Powerful tool for hypertension, neuropsychiatric disorders. Bring the awareness now completely. Put your index finger and middle finger, it's called a Vishnu Mudra, in between your eyebrows, in your third eye, and use your left hand and hold into your right earlobe. This is what we call a super brain yoga. It balances, because this is a balancing pranayama. It balances both sides of the brain. Do alternate nostril breathing. Wonderful practice. At home you continue. It's also meditative pranayama. You'll be able to do closing your eyes. You close your eyes and you do the alternate nostril breathing without any closing your nostril. We'll finish, we'll do it when finishing meditative practice. Right? Like when you are, body, mind is together. Body is called a gross body, called Sthula Sharir, and your mind, body of your mind is called Shukha Sharir, subtle body. My eyes are closed, I'm looking at my body because it's an imprinted memory. I know every part of the body. I can touch my nose, touch my head, I can hold my earlobe. My eyes are closed. I can touch my left knee, my left correct toe, anywhere. That's the way I can regulate my breathing on the both sides. You can incorporate breath holding called kumbhaka. The terms you use in English is called inhalation. Sanskrit called puraka. Then you breath hold. It's called kumbhaka. Breath holding in inhalation is called retention. It's called abhantarin kumbhak. Breathing out is exhalation. Sanskrit called rechaka. And breath holding in exhalation is called suspension. It's called Vajra Kumbhak. So we'll be doing Inhalation through one nostril, breath holding and exhalation, ratio of 1:4:2. Count of 4 in, count of 16 hold, count of 8 out. When you can do a little bit more and more, effortlessly, we do count of 5 in, 20 hold, 10 out, 6 in, 24. We can do even a 10 in, 40 hold, 20 out. Let's do very simple at the beginning. What you'll be able to do, use your left hand again in Dhyana Mudra. Right hand is a Vishnu Mudra. Drop your index finger and middle finger down. Make a pinch with a little finger, ring finger, and your thumb. Put it over your nostril. Breathe out through your left nostril with a count of 4. Breathe out first. Breathe in through your left nostril with a count of 4 in. Hold your breath for a count of 16. Breathe out through the right nostril at the count of 8 out. Breathe in through the right nostril with a count of 4 in. Hold your breath for a count of 16. Breathe out through the left nostril, count of 8 out. Wonderful practice. Nadi Shodhana practice. You feel profound level. Take a look. Take a look at my guru. Google herring brewer reflex. The locks are very important. You keep your neck straight. Slowly drop your chin down. Touch your chest. It's called a chin lock. It massages your carotid sinuses. It is a profound relaxation response. When you do with your inhalation holding, you inhale, hold your breath, incorporate chin lock. It is a powerful relaxing response. It is so powerful, it is called a Murcha Pranayama. Murcha is like a fainting. Very nice for you to go to sleep. So the technique is, you breathe out first, take a deep breath in, hold your breath, slowly drop your chin down, touch your chin to the chest, and keep counting how long you can hold. Wonderful practice of relaxation. Murcha Pranayama. Breath holding in inhalation with a chin lock. You do it as long as you can do effortlessly, 3 times, 5 times, wonderful. I'm showing you the technique for you to practice at home. Daily practice. If you want to come to my class, I generally do only once a week. So, it's not that what you do 1 hour of yoga, 2 hours yoga. What you do for rest 23 hours more important. Abdominal lock, Uddiyana Bandh. This is breath holding in exhalation, called Bajjo Pranayama. Abdhundra. This was breath holding in inhalation. So the technique will be, you breathe out first, take a deep breath in, Completely breathe out. Suck your stomach in and hold. Breath holding in exhalation, Bhastrika Pranayama, it creates a negative intra-abdominal pressure, improves the perfusion of the organ, profound relaxation response. To the root lock, Mula, in the same in exhalation, contract your pelvic floor, contract your anal sphincter, pull it up and hold. When you do all the three together, it is called your great lock, Mula Bandh. Let me show you one Mula Bandh. So, and then we'll do a couple of more pranayama. We'll do a little pranayama as a meditation. We'll finish. Like we already done a Bhramari Pranayama. That is a meditative pranayama. We'll do a Pranabha Pranayama. We'll do a alternate nostril breathing without closing a nostril. Relaxation. Adhi Mudra. Breathe out first. Take a deep breath in. Completely breathe out. Suck your stomach in and hold. Slowly contract your pelvic floor and pull it up. Drop your chin down slowly, touch your chin to the chest and stay here. Wonderful practice. You get a smile in your face. Agnisar Kriya, very powerful sign for health. You move your relaxed abdominal wall to massage all the organs. Same way, you breathe out first. You deep breath in. Completely breathe out. Moving your abdominal wall to massage the internal organs. You also can do a Noli, isolate your rectus muscle, move side to side, Noli Kriya. Ujjayi Pranayama, you constrict your larynx, try to breathe in. It is a very relaxation. It stimulates the laryngeal nerve, superior and inferior laryngeal nerve, and it sends a signal to the brainstem. From the brainstem sends a signal to the glossopharyngeal nerve, which goes to your soft palate, which supplies your palatopharyngeus and glossopharyngeus, tightens of the soft palate. It literally corrects your snoring. It also supplies hypoglossal nerve. It pushes the tongue in front, and it corrects your sleep apnea. Wonderful tool for a sleep apnea and a snoring. It is so relaxed, you will see that when you do the Ujjayi Pranayama, you will see that it will become with your abdominal lock. The Ujjayi Bandh will set in. Then it is so relaxing that you incorporate your Jalandhar Bandh, chin lock, then you do breathe out your left nostril, because the left nostril is cooling. Totally a cooling practice. Let's do one time, you'll see how beautiful it is. So you breathe out first. Take a deep breath in. completely breathe out. Big smile in your face. Ujjayi Pranayama, abdominal lock, chin lock, and your Chandravedhi Pranayama, breathing through the nostril. Pranaho Pranayama, Om has a three component, A-U-M, A-U-Ma. A comes from the lower part of the lung, U comes from the middle part of the lung, Ma comes from the upper part of the lung. You can do all together with one Om Pranayama, or you can do separately with the three mudras. It's called a chin mudra. When you touch your index finger and thumb, putting your hand down, this is a meditative pranayama. So at the end when you meditate, pranayama takes you to meditation. Then you will do a alternate nostril breathing and just moment of silence before you finish. So, chin mudra, put your hands down, breathe out first. Take a deep breath in. Chinmaya Mudra, U. So breathe out first. Take a deep breath in. Mudra, Ma. So breathe out first. Take a deep breath in. Keep your eyes closed. Bring your awareness in your nostril and breathe out through your left nostril. Breathe in through your left nostril. Breathe out through your right nostril. Breathe in through your right nostril. Breathe out through your left nostril. I can clearly see I'm breathing through my left nostril, breathing out through my right nostril. Just continue this few times, then I'll give a signal for you to get into a little silence. Silence, control your five senses, and with a short silence, we'll come back to the end of our session. Alternate nostril breathing without closing your nostril. Stay in the silence. Just pay attention to your breath. Just visualize your breath is bringing prana. Prana is going to the organ of healing and causing healing. Slowly bring your hands in front of your heart chakra, Anahata Mudra. Touch your little finger and thumb. Separate your ring finger, middle finger and index finger. It's a lotus mudra, Padma mudra. Slowly bring it close to your heart. Heart is the site of your soul, and you do all the healing at the level of your heart. A practice, a healing from within, gives us all the wellness, gives all the healing. Healing of your lung, healing of your heart, healing of your brain, healing of your own essence. A wonderful practice, healing from within. Slowly again finish with your pumping and cupping. Keep rubbing your hands, keep rubbing your hands. When you feel the warmth in your hand, if you're wearing glasses, remove your glasses. Put your hands over the eyes as a cup and massage your forehead. Massage your eyes, massage your ear, your auricles, your tragus, your external auditory canal, face, the neck, carotid sinuses in the back, and slowly open your eyes. It's a wonderful practice. Finish it today. This was yoga therapy, healing from within. And as you said, our healing comes from improving your lung function, improving your heart function, improving your brain function, improving your cellular function. Thank you for joining. We'll be doing again the next Saturday for another session, and I'll make an announcement in my Facebook page.